Good. Welcome to True Health Tuesdays. Today is going to be the most violent comments I've ever received on YouTube. Okay, because we're going to talk about strokes. Now, there's a lot of misconceptions. We're going to go over the causes, and the causes literally are medications, toxic food, but basically unhealthy blood. Now, when you look at the prevalence of this, it's ridiculous. If I told you that a herd of water buffaloes, you're talking 5 out of 100, okay, are going to have a stroke, we'd think that there'd be something wrong. Okay, 33 million people in the world have strokes, okay? Second leading cause of death, fourth leading cause of death in America. A stroke happens every 40 seconds. So there's something wrong with this. Now, there's two types, but I want you to critically think, because that is completely not common in the medical world. So, they have this mantra. There's two different types of stroke, a hemorrhagic or thrombotic stroke. Really? Why? Okay, why do the blood vessels burst? And how come the arteries are the ones bursting and not the veins? Okay, when we look at this, and what is thrombotic? They have all these theories that if there's an arrhythmia, if there's an interruption in the heart rate, that the blood is all of a sudden going to stick together and clump together. Okay, that would be a pretty inefficient species. So what I want you to look at is, let's look at the structure of the things that are involved in here. So now arteries have 3 different layers, and the middle layer is a muscular layer. The biggest thing with an artery is that it can constrict and dilate. So if your blood pressure goes too low, your arteries can constrict, just like putting your thumb over a hose, to increase the pressure. And this is also, you're going to see, one of the reasons why medications cause strokes, because if you take a drug to lower your blood pressure actually does go low. And if it's too low, you're going to start to pass out, because you need a certain amount of pressure inside of the brain. So the arteries are going to constrict in order to elevate the blood pressure to keep the brain alive, because blood actually has a function. Now, clots don't form on the inside of the artery. Okay, you can see from this picture here that there's something a little bit different. Now, since an artery has a muscular layer, there's actually blood vessels that go from the lumen, or the space inside the artery, that supply that muscular layer. They're called vasovasorms, or blood vessels of the blood vessels. Now, anything that damages those little tiny blood vessels is going to weaken the wall. Now, the body, in its wisdom, is going to lay down a protective layer of calcium, cholesterol, and plaque, okay, to protect that weakened muscular area. Now, here's the problem. If you have an artery that has that arterial damage from some type of toxicity or deficiency, and then you take a drug to lower it, all of a sudden that artery constricts in order to raise blood pressure, then you're going to have a problem. Now, the picture up on the left here of those little tiny round circles, that's a normal view of what blood is. Now, blood, it's a biconcave disc. It's kind of like bolting 2 Frisbees together. Okay, and it's that because it has a huge surface area that holds more oxygen. It's just very efficient design. The problem is, if you have low stomach acid, toxic food or diet, the blood forms together in these things called roll of coin formation, or rouleau coin formation. Now, you can imagine that if you've got a whole bunch of these little tiny discs, they're holding a ton of oxygen, so the blood's efficient. If you have rouleau coin formation, there's not a lot of surface area there, so the blood is not going to be efficient at what it does. Okay, so I'm walking you through this because when we're talking about strokes, blood does not clot in the arteries, it clumps in the arteries. So what's the difference mean? Let's look at the function of blood. Blood does a few things. Okay, it carries oxygen, it brings nutrients, eliminate waste products, vital to the immune system, it transports hormones. I mean, it has a function. And if this function, regulates pH, body temperature, If the blood isn't efficient at what it does, it requires more blood to get the job done. Okay? So let's just talk basic, uncommon sense. No, we used to say it common sense, but it's really uncommon sense because this involves critical thinking and actually using your mind. I mean, when we look at this, the Journal of the American Medical Association, when we're talking about blood pressure, it's one number for everyone, right? Okay, you know, and what's the blood pressure number now? 120/80? No, I'm sorry, you're wrong. Okay, that was Joint National Committee of 7, okay, and it changed about a year and a half ago. It's now 159/95. Yes, yes. Okay, so I just want to get you out of the Joint National Committee, okay? Understand that there's a building, white smoke comes out, and they have this book, and everybody's to buy. Sorry, that's my Catholic upbringing. Okay, that's how they choose a pope. No, but you understand, okay, it doesn't make any sense either way. Okay, so here's a great study, 48,000 patients, and they found out, and these are patients with heart damage. So is their heart muscle good or not? Well, not good. Yeah, they got heart damage. It turns out that if they had higher blood pressure, systolic over 161, that they had less death rates. So let's use the critical thinking again. That means that the muscle's not very efficient, so it requires higher blood pressure to get that blood going through to carry the oxygen to do the function of the blood. Okay, does that make sense? Okay, so now when we look at this, here's a number of different, and I know the references are kind of small, but I had to pack them on this one thing. If you're taking beta blocker, angiotensin, blood pressure drugs that slow the heart down, does it help oxygen and nutrients flow to the system, or does it also slow that down? Slows it down. Okay, so this is critical thinking again. Okay, so now what caused the blood pressure to be higher in the first place? Was it that the blood wasn't healthy? Okay, so if the blood isn't healthy, your body adapting is going to have to elevate the pressure in order to have the blood do its functions. And sure enough, if you take drugs that slow down or lower that pressure, you're lowering down the efficiency of what the body is supposed to do. So early death from heart disease, cancer, diabetes, from chemically altering your physiology. Now this is the rub. This is where psychosis goes. You got blood that's inefficient at what it does. You still need to have oxygen and nutrients going to the tissue, right? Okay, so it's inefficient. So what has to happen to blood pressure? It has to go up. You've got arteries that used to be good and healthy, but through a diet of polyunsaturated fats, toxic food, and medications, it's now becoming smaller. So in order to get the same number of nutrients through that space, what has to happen to blood pressure? It has to go up. So when you're reading this literature over and over and over again, leading cause of stroke is high blood pressure. No, it's not. Leading cause of kidney disease is high blood pressure. No, it's not. That's foolishness. If you have inefficient blood, you have inefficient arteries, the body through its adaptive mechanism is going to raise blood pressure to have you survive, even though you're too stupid to eat proper nutrients. Okay? You know, I mean, you think that, you know, the 4 food groups and the Dairy Council. So, consistently, I've had so many patients say, oh man, I got a headache, it's hurting like crazy, and I checked my blood pressure and it was high. High blood pressure does not cause headaches, but pain will cause blood pressure to elevate. Okay, there's a big difference there. When you're working out in the gym, okay, you're lifting that weight, okay, your blood pressure's going up. Do you see these big tough guys put down the weight and say, oh God, I gotta stop. I get a headache. It was just my pressure was too high. No! Okay, let's use like common sense, okay? So now, then we have ignorant doctors like this. Okay, you may have heard, okay, from barbarians like this. Neck manipulation may be associated with a stroke. So this means chiropractic care can cause a stroke, according to this guy. Now, he said this a couple of years ago and it flipped me out. But, you know, of course, chair of neurology, so he should understand the nervous system. Chicago School of Medicine. Treatments involving neck manipulation may be associated with stroke, though it cannot be said with certainty the neck manipulations cause stroke. Okay, so let's actually look into that. Okay, for one, he's criminally misleading. He needs to be shot. Okay, Frank Silver, researcher, professor of medicine, Toronto University, they said they didn't see any association between chiropractic adjustments and stroke. So they looked into it a little bit deeper. It turns out for every 1 in 5.8 million adjustments, you can have a damage. Okay, that's about 1 adjustment in every 48 careers. Now, if you take a non-steroidal anti-inflammatory like an ibuprofen, a Motrin, a Aleve, you have a 1,500 times greater rate of damage, okay, death. And you have a 1 in 600,000 or a 10 times greater rate of getting struck by lightning than hurt by a chiropractor, okay? And what they're talking about, and this is huge because it's a very small group, it's called vertebral artery dissection. It's these little arteries that run up the side, and they're saying, oh yeah, from turning the head you can burst it. Well, that's not actually true, okay? Because when we put this risk in perspective, they did studies on chiropractic patients, people that had their neck mobilized, healthy, and corrected, as opposed to people that didn't get it. It turns out that the general population, and again, this is the medical world, so not people that are intelligent getting adjusted, their risk of stroke is about 2 in every 100,000. Okay, they just stroke out. They're walking along, you know, they're eating the standard American diet, talking to their doctor, following all the great advice, but they're sure as hell staying away from the chiropractor. Okay, they have a 2 in 100,000 per year dying of stroke. However, the people that go to a chiropractor, they have a 1 in 5.8 million chance. So the risk of stroke with chiropractic care is 0.0, and there's 6 zeros, 0.00000017. And a stroke without chiropractic care, it's 0.00002. So you have thousands of % increased risk of stroke if you don't get your neck adjusted. You have a 7 in 10,000 risk of dying from lumbar surgery. How many surgeries did chiropractors stop? Hey man, 20 years I've been doing this. We saw 224 people on the slow day of the week. That's today. Okay, I've referred 4 people for surgery in my career. Okay, how many thousands of surgeries have we stopped? God knows. A 2-month course of non-steroidal anti-inflammatories. Is this a common prescription? Yeah, 1 in 1,200 die. Okay, and death rate for acetaminophen is 1 death for every 2 million tablets. This is what drove me crazy. This guy comes in, now I'm looking at him. Okay, we were seeing a reverse curve in his neck. On the side view of the lumbar, we're looking at a calcified descending aorta. I mean, this means this man has got to have high blood pressure because the artery is starting to harden. It's so friggin' hard I can see it on x-ray. And this guy has had blood pressure issues for over 10 years and cholesterol pills. Now I know both the blood pressure and cholesterol pills are damaging his brain and damaging his body. And I said, buddy, luckily we can help you. Okay, you came in time. You know, within about 2 weeks, your blood pressure is going to be too low. We're going to be able to get you off of those drugs. We're going to get your nervous system restored. You'll be fine. I'm not going to let you touch me until I talk to my cardiologist. Okay, your cardiologist has got a lot of skills in reversing arthritis and correcting the autonomic nervous system. You know, it's like, my God. Okay, here's a study comparing medical procedures to chiropractic care. Okay, just to put the last nail in the coffin of this ignorance. Okay, 2 times greater risk of dying from a blood fusion than, and this is only at a 1 in 1 million chance of getting hurt by a chiropractor. 100 times greater risk of dying from general anesthesia. Up to 400 times greater risk of dying using non-steroidals. 700 times greater than lumbar surgery, 10,000 times greater than gallbladder surgery, and 10,000 times greater than the standard mistakes in hospitals. Now, Enbrel, that funky, weird little vertebral artery dissection that's so rare, okay, it's very common if you take drugs. Okay, now Enbrel is used for autoimmune diseases, rheumatoid arthritis, things like that. They have about 3 deaths for every 174,000 people. Now, of course, the people that are taking this drug are also taking blood pressure drugs, steroid drugs, high blood pressure drugs, drugs for constipation, drugs for insomnia. Okay, so it's probably not just that. Humira. I love the commercials, by the way. They're really cool. But these have 4 for every 135,000 people. So this is like a tremendous amount. This is very, very dangerous stuff. So, and then finally, and I love this one because they have an older population. Okay, I just adjusted one of my patients. He's a military pilot. Yeah, he was flying in World War II. He's 99 years old. Okay, so they want to check, and I love this. Summary background data. The risk of physical injury due to spinal manipulation has not been rigorously evaluated for older adults, a population particularly vulnerable to traumatic injury. Okay, now when I'm adjusting anyone, whether it's an infant, senior, sports guy, I use this finger. That's not the scary one. This is the scary one. Okay, I use this finger and about 2 to 4 pounds of pressure. That is not traumatic. Okay, it's very, very easy. And so what they did is they took this group of older Americans. Some of them went to a chiropractor to be evaluated, just to be evaluated, and some of them went to the standard medical doctor to be evaluated. And what's interesting, to evaluate for risk of injury, head, neck, and trunk. And they also evaluated for adjusting risk of injury within 7 days. Well, it turns out that 382% increase in risk if you went to the medical doctor. Okay, now I'm going, wait a second. So 40 injuries for every 100,000 people. I don't know how the chiropractors were evaluating them. But primary care, 153 incidents. So almost 400% greater. Okay, I mean, you're a medical doctor. I have no idea what these guys are doing to evaluate. Hi, let me see how your head moves. Jesus. You know, if you're only going to prescribe drugs, just stay the heck away from touching people. Okay, last one. 2010 task force on neck pain disorders. Researchers found patients no more likely to suffer a stroke following a visit to a chiropractor than they would stepping into their doctor's office. Malpractice insurance for a chiropractor. We're one of the busiest offices in the world. I pay about $1,600, $1,700 a year. A buddy of mine who's an osteopath and he does prescribe drugs, he's about $45,000 a year. I mean, you know, it's nuts. So these are the causes of strokes right here. High blood pressure, drugs, not the adaptation of high blood pressure. Cholesterol drugs, proton pump inhibitors, aspirin, toxic food, processed foods, polyunsaturated fats, and dehydration. So when we look at it, and this is what's interesting, because remember the mantra, okay, when you get these guys saying, oh, high blood pressure is the leading cause of strokes. It's not. Okay, and in fact, this one study, it was published in blood pressure medications can lead to an increased risk of stroke. Wait a second. High blood pressure is supposed to be the cause of stroke. But now this article says the medications they give you for high blood pressure cause a stroke. Scientists found that the risk of stroke went up by 1/3 for each blood pressure medication taken. People who needed 3 or more medications were 248% higher risk of those who had normal systolic blood pressure. You're in as much trouble by the time you're on 3 medications that achieve excellent control as you are when you have high blood pressure that is untreated, which is amazing. It's amazing to him because he has no critical thinking. Let's look at this. If you take a chemical to lower your blood pressure, that lowers your blood pressure, right? Okay, what does your body do to the blood vessels to adapt to that toxic influence? It constricts them. Okay, this is no mystery. You're taking a drug that's going to cause arterial constriction, and you've got crappy blood and crappy arteries. Okay, that was the first sign of the high blood pressure in the first place. Your body's only going to raise blood pressure if there's a toxic deficient environment. Does that make sense? It's like, duh. We want to raise the issue that despite great advances in pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. Yes, I know you're sick. I know you've got erectile dysfunction. I know you're depressed and anxious, but your blood pressure is normal, thank God. We have it under control. And then you go up to the doctor and you say, Doc, I just read this study that said the 3 blood pressure medications I'm taking increase my risk of stroke. You know what the doctor's going to say? Yeah, but your blood pressure is fine right now. We got you covered. Okay. Now, we've got a couple of patients who are nurses in stroke wards. Now, again, let's just talk on common sense here, okay? I really like that term, you know, when we were kids, it was common sense, okay? Okay, if you have lack of oxygen to the brain and the brain is dying, would it make sense to increase the oxygen to the brain? That's what they do. After someone has had a stroke, they artificially raise the blood pressure. And I thought, my God, that's brilliant. That makes a lot of sense. So here's a couple of journal articles. One published in the Study of Stroke, the other published in the Journal of Neurology. Induced hypertension. So they're counteracting, they're actually causing high blood pressure in here, is the standard therapy for cerebral ischemia, which means less oxygen in the brain. Okay, blood pressure should be pharmacologically increased in patients with hypotension and changing the neurologic symptoms. So they're talking about raising the blood pressure with an acute stroke not to exceed 200 millimeters of mercury. So when I get patients in here that say, yeah, man, I just got through exercise and I was worried, I took my blood pressure and it was, 160, 180, isn't that dangerous? I can say, no, man. What the studies show that if you've actually had a stroke, they want to raise your blood pressure systolic to over 200 or up to 200 to keep oxygen flowing to the tissue. Let's start respecting the body a little bit. Does that make, it kind of makes more sense to me. Cholesterol drugs increase your risk of stroke. Oh my God, I thought that's what they give you to prevent stroke. Well, not if you're common sense. Our analysis indicates that in settings of high recurrent intracerebral hemorrhage risk, avoiding statin therapy may be preferred. No kidding. Statins are commonly used. Boy. Yeah. Okay. If you got a 6th sense of humor, they're comically used, okay? They're commonly used to prevent heart attacks and strokes. However, as statins could increase the risk of second stroke in these patients, outweighing their heart benefits. Yeah, but at $11 billion, I mean, this is one of the most profitable drugs that the world's ever seen. Here's again, Mr. Fit. This is 350,000 people, 6 years long. This was a really, really thorough study. Despite the opposing relationships of cholesterol levels and ischemic and hemorrhagic strokes, the distribution of risk is not even across the cholesterol levels. In the large Mr. Fit trial, for example, stroke mortality was lowest between 180 and 200 cholesterol levels. Mortality substantially increased below 180 and above 240. It was the highest below 160 and above 300. Did your doctor tell you that? Okay, so we're talking about the function of blood, right? What's the function of cholesterol? Oh, cholesterol is a precursor to every hormone you make. Every glucocorticosteroid, mineralocorticosteroid, sex hormone. My God, this is like 70% of your brain. So if you don't have enough, you can't produce healthy tissue. If you have too much, it's in response to some type of tissue damage, hormonal assault, or some type of inflammatory condition that you need more cortisol. I mean, it's an intelligent response. Cholesterol levels are going to go way too high if you have tissue damage. You don't need to shut off the fire alarm. You need to fix the problem. Now, British Medical Journal, influence of cholesterol on survival after a stroke. Survival. Hemorrhagic, that's when the blood vessels burst, is more dangerous than the ischemic stroke. That's the clumping of the blood vessels or blood cells. A comparison of the two types showed that 7% of ischemic stroke victims die within a month, whereas 28% of hemorrhagic stroke victims die within the same period. Low cholesterol levels are associated with decreased survival rates. Decreased survival. A Scottish study found 40-point decrease in serum cholesterol was associated with a 9% increased risk of mortality for all types of stroke. Wait a second, what's the function of cholesterol again? Oh, it produces every glucocorticosteroid, mineralocorticosteroid, sex hormone, vital for tissue repair, and vital for inflammation. My God, maybe cholesterol is good for us. Proton pump inhibitors. Remember those red blood cells that stick together in that rouleau coin formation? If you have low stomach acid, they get sticky, and they because you can't produce the amino acids or get the amino acids from the proteins. So the blood cells get sticky. Now this we've known for, decades. Proton pump medications can increase your risk of stroke. This was a Danish study, 245,000 people, 6 years of following it. Nexium, Prevacid, Prilosec, Protonix. All these drugs increase people's stroke by 21%. Not even that. Okay, these drugs do a heck of a lot more than that. If you're lowering the stomach acid, you're causing your body to not break down nutrients. How about irregular heartbeats because you can't get magnesium? How about muscle spasm, convulsions, cognitive decline? And this is from lowering stomach acid. And when we talk about indigestion is not from too much stomach acid. So it's prescribed because of ignorance and arrogance. I mean, yes, I'm smarter than your body. You need this little purple pill for 24 hours of relief. Really? Aspirin a day for a healthy heart. Most definitive study ever, except this is only checking aspirin. They're not checking that other blood thinner that you have there. Could you hold that up, that blood thinner you have there? Yes, it's a mixture of two gases, hydrogen and oxygen. They form this liquid called, what was that? Water. Yes, that's a good blood thinner. Honest to God. They're comparing an aspirin, one of the leading causes of kidney disease, okay, to nothing. Okay, and they found out that if 100,000 people take an aspirin a day, 33 to 46 fewer deaths from heart attacks. However, 68 to 117 people will die from gastrointestinal bleeding, and about 10 people will stroke out. And we're not even looking at the kidney disease here. Okay. Clear that there is an incredibly fine balance between possible benefits and risk of the intervention. We need to be extremely careful about over-promoting aspirin intervention without having first fully understood these negative side effects. How about water? Yeah. Oh, don't talk herbs. Crazy. Okay, American Heart Association salt guidelines, and you hear this over and over and over again. Salt's bad, salt's bad, salt's bad. No, it's not. Okay, in fact, they recommend 1.5 grams per day. It turns out that if you have 4 times that amount, you have less heart attacks, less heart issues. And I love this. Dr. Topol from Medscape, I mean, some writers are good. This guy is good. The American Heart Association, however, isn't backing off from its sodium guidelines. But I think there's a big lesson about guidelines without adequate evidence. Could we insert just what we talked about? The blood pressure drugs, the cholesterol drugs, okay, the crazy stuff? Okay. Big lesson about guidelines without adequate evidence. They can do harm. Hopefully this lesson will prove to be impactful because it certainly has not been the case, as in, what's he saying? Cholesterol, blood pressure, PSA, mammograms, and a long list of poorly conceived non-anchor guidelines. See, there are doctors out there that get the big picture. Good God, they're not popular, but they're out there. Okay? I mean, salt, when you look at this, you see this mantra, salt is bad, salt is bad, salt is bad. And it's not true. Okay? Journal of Hypertension, 6,250 subjects found no strong evidence that cutting salt intake reduced the risk of heart attack, stroke, or death in people with normal or high blood pressure. There are people dying of hyponatremia in those senior centers over here because they're talking about low salt. Salt, you need it to get fluid into the cells. Healthy salt, not the white table salt at Denny's. Okay, I'm talking like Celtic sea salt, Himalayan salt, salt with a mineral. It's absolutely vital. Oh, another European study was published in the Journal of the American Medical Association on the greater risk of dying from heart disease was people that had less salt. Remember this, okay? Now, we talk about healthy blood cells, the red ones, the ones that can hold oxygen. So if your blood is efficient, your blood pressure doesn't have to be that high. If you have blood on the right, okay, where it has those rouleau coin formations, so what causes them to get sticky? Well, we know low stomach acid, okay, and we know, so that's poor digestion, but also polyunsaturated fats. Now, and that's vegetable oils. And this is something, unless you're educated, and you go out and get the healthy granola bar that has the cottonseed oil in it, okay? I mean, this is sick and disgusting and toxic food. Polyunsaturated fats to this level is crazy. Healthy omegas are to have a 1-to-1 or 3-to-1 ratio of omega 6-to-3 ratio. Safflower oil 77-to-1. Okay, corn oil 60-to-1. I mean, it's insane. Then you look at the journals, okay? And I love this because I get comments, oh, you're just talking. No, I'm actually able to read a journal, okay? Increased polyunsaturated fats, doubled the stroke mortality. Doubled the stroke mortality, okay? The European Journal of Clinical Nutrition. Polyunsaturated fats are vulnerable to oxidation within the body and incorporate into lipoproteins, would make those lipoproteins more likely to oxidize. But next week we're going to talk about oxidation, so that one will make sense after next week's lecture. But just understand, remember, you got these polyunsaturated fats, you've got this toxic nutrients. This is one of the items that's actually damaging the arteries. So if you're having arterial damage, the body is going to protect that with cholesterol, calcium, and fibrin. Okay, it's a protective mechanism. So if cholesterol's going up, it means your diet's toxic, or you're inflamed, or there's some problem. It's not, my God, let's remove the fire alarm because it's too loud. Okay? Fatty fish, phenomenally good for you. Omega-3s, I mean, the puzzle of dietary fat intake and risk of ischemic stroke. Okay, when you look at it, there's evidence that fatty fish is protective against a stroke. My God, we use it for the autistic kids. We use it for people with dementia, with Alzheimer's. It's one of the greatest fats around for brain function. Carbohydrate intake. A prospective study of cerebral artery atherosclerosis in stroke, 1988. So, and we're not talking carbohydrates from like lettuce. Okay, we're talking about from white bread, wheat bread, rolls, biscuits, pancakes, pizza dough, pasta, onions, I mean, buns. I mean, this is processed stuff. Okay, if you get the sprouted grains, I mean, you can have healthy bread, but we're not talking about that. We're talking about the poisonous stuff. Most frustrating thing is when we get a patient like this, and this is his before and after x-ray, you know he's hurting. So is his sleep poor or good? Poor. How's his gastric motility? Is he having 3 bowel movements a day, or is he toxic with 1? Okay, is his blood healthy or not healthy? So the doctor goes in and says, yeah, high blood pressure is the leading cause of strokes. It's not. It's the leading clue to people that are aware that your blood isn't healthy at what it does. Jesus, you know, we got to fix the body, clean up the blood, clean up the act, and the body gets better. So this is what you do to protect yourself from strokes. Okay? Oh, no, I was going to put a sign up here that said, don't poison yourself. Okay? Fill your body with healthy nutrients, okay? I mean, it really seems too simple, but that's what we got to do. Annals of Internal Medicine, 125,000 healthcare workers. 1 serving of vegetables and fruits a day cut their risk of heart disease. I mean, and this is like basic good stuff. Flavonoids, and that we're talking in preventing cholesterol from sticking to artery walls. Well, for one, that's the American Journal of Epidemiology. Cholesterol does not stick to the artery walls. Okay, so they're off on that. But lowering cholesterol, it's because the cholesterol has a function. It's a major anti-inflammatory. What do you think plant products are? Major anti-inflammatory. They allow the body to function and to heal itself. Now, how about we clean the blood? Everybody knows fibers clean the intestinal tract. Those are the insoluble fibers. How about we actually find something that can clean the artery? Okay, and that's what juicing does. See, when you get a juice extractor, it literally breaks down these fibers, puts these insoluble fibers that you can't digest over here, and gives you a glass of soluble fibers that'll clean the arteries. Oh my God, so if you've got years of damage, this is what you want. This is actually my old house. This is back when me and my 2 boys were together. That's literally our production line, okay? Because, I mean, I'm doing a jar of juice a day. My son's doing a jar of juice a day. He's doing a jar of juice a day, you know, and so, you know, they last for 4 days if you're having a slow speed masticating juicer. Yeah, go big or go home. And think of it, when you're eating a carrot, you can't really chew it up a whole bunch. And a lot of people will say, well, what about blending? Blending's cool, it'll break it down. But when you got a blender and you're putting a couple of apples and a carrots in there and, you know, some celery, and you grind it all up, you're getting the benefit of like 4 or 5 pieces of fruit. If you're getting a 32-ounce jar of juice, you're having like 10 carrots, 5 apples, okay, some celery. You're getting those soluble fibers from 3 to 4 pounds of vegetables in that 2-pound jar of juice. Again, juicing, it's a way to get the nutrients in there. It can literally clean the arteries. I mean, these are angiograms, which are completely inaccurate, but you can see pre and post angiograms where it shows it clear. I wouldn't recommend anyone getting an angiogram just for shits and giggles. It doesn't work. But again, prevent heart disease and cancer, flavonoids, broccoli, tea, apples, American Journal of Epidemiology. It just makes sense, you know, to clean the blood, have healthy blood, and the body adapts. Vitamin D exposure, vital for your health and immune system, and you need the fermented foods. Again, this is to help the gut bacteria, it's to help the immune system. Natural sources of vitamin K. I mean, this is just, I'm putting weird stuff up there like leafy vegetables, onions, Brussels sprouts, cabbage. I actually have people in here that say, good God, how can you, yeah, how do you eat that? And I actually have that on some of the sheets. So when we talk about preventing stroke, you obviously got to get your nervous system checked, okay? And that's by a corrective chiropractor. Regular exercise, this actually helps with blood flow, helps with oxygen, helps with generating a healthy body. Proper nutrition, if man makes it, you don't eat it. Deep sleep every night. If you have a chronic illness or chronic disease, I can almost guarantee that your sleeping sucks, okay? No, I sleep like 9 hours a night. Okay, really, how do you wake up? Well, I'm tired all the time. Okay, honest to God, I hear this every freaking day. Okay, yeah, and you can change sleep patterns. And then prayer and meditation. This is how to change your mental and emotional state, because emotions are chemicals secreted by how your brain perceives the environment. You pray and meditate every day, are you going to perceive the environment better? Yeah. Now, we do have a cruise coming up. This one's going to be in Europe. It's going to be a blast, okay? If you want to hang out, okay, in Barcelona, France, okay, and Italy for 8 days, we got some amazing speakers on it too. So, I mean, I really don't know. I think there's probably like 1 or 2 cabins left. Last time I heard there were 4 cabins last week, but this is fun. Okay. Yeah, we're definitely going to work on strokes. Okay, now. Yeah, well, they do have a martini bar that's kind of cool. Okay, and now, any questions? Yes, ma'am.
Would ozone therapy help to better the blood?
Zone therapy, what's that?
Ozone.
Oh, ozone therapy. Oh, yeah. Oh, yeah, but ozone is more like a critical thing. If you've been exposed to toxic chemicals, EDTA or chelation therapy is going to be ideal. Ozone therapy is going to be ideal. Hyperbaric chambers are going to be ideal. Yeah, so I mean, if you've been, under the toxic care of a medical professional, not you, my brother. Okay, you're gonna need, the forest is on fire. You're gonna need to put it out. So there's a lot of ways to oxygenate, clean the blood, hydrate the blood, but the body heals so fast. You're talking 120 days. Every red blood cell you got's brand new. Yeah, so just start tonight. Get deep sleep. Wake up with some juice in the morning, and you're gonna be fine. Yes, ma'am.
With the beta blockers, if somebody's on that and they want to get off, you always hear the doctors say, don't just get off of one of those. You have to slowly do it, or don't do it ever, or you're going to stroke out. So if somebody's on a drug like that, what do they do?
Oh, this is perfect. This is when I talk to doctors, you have to get the person to understand that the drug does not make them healthy. Okay? And you do it like this: sick people need drugs. Okay, so all of a sudden they think, oh, wait a second. Okay, and what would happen if a healthy person took that same beta blocker? They would get sick, and that's what they'll say. So you got to change their mindset, and then show them how to take blood pressure. And again, you got to walk people through, because we're talking uncommon sense. Do you want to take blood pressure when you're hiking upstairs, or when you just had 4 cups of coffee, or when you're bike riding? They'll say, no, of course not, because I want lower blood pressure. Okay, then you got to be in the same metabolic state, okay, in order to get an accurate reading. So you have to deep breathe for 10 to 15 minutes, diaphragmatically with your arm level with your heart. Then you check it. Then you call up the doctor that gave you the drugs, and you say, I've done some lifestyle changes. These are my numbers. Which one can I reduce? Because we know if you're taking 2 or 3 medications, your risk of stroke is just about tripled. Okay, so it's incredibly dangerous. And you call up the drug dealer, or the healthcare professional that is trying to raise your level of stroke. Okay, and you say, doctor, I've made some lifestyle changes. Okay, and he'll say, cut 1 in half, do this, but check it, and then he'll scare the heck out of you by saying, it's a silent killer and blah, blah, blah. Okay, and he'll say, yeah, I just saw Bergman's video. That's a scary one. Okay, so you're just going to walk him through it. Okay, better yet, find a doctor that understands that your body is self-regulating and self-healing, and saying, look, man, I got this. Like the Whitaker Wellness Center over here in Newport Beach. I mean, the first thing they do is they get their patients checked by a chiropractor and get them off of the drugs. Okay, our patients, and I tell them, you talk to the doctor, he's going to say reduce it, in half for 2 weeks. Then you call him up again, then he'll say stop 1 in 2 weeks. And it usually takes about a month and a half to get off 2 or 3, 4 drugs. But we don't tell them to stop. We just educate them, show them how to check it, okay, and then they don't need it. Or you could buy this machine. It's called Respirate. It costs $350. And I actually got one once. It was fun. It has a thing that monitors your breathing, and you listen to a tube, and it causes you to deep breathe slowly for 15 minutes, and it's guaranteed to lower blood pressure when blood pressure medications aren't effective, FDA approved. Yeah, or save the $350, deep breathe for 10 minutes. Yes, sir.
Yeah, I've had a couple friends who have had strokes, and they get the left side or right side paralyzed. Mm-hmm. Is there any hope for them?
Oh, absolutely. There's a great study going on right now in India on chiropractic care to rehabilitate and get both halves of the brain to fire off correctly. Oh yeah, we get people in here all the time.
Does it have to be done immediately or?
Well, the sooner the better.
Yeah.
Because the brain functions like a battery and it gets its charge from the normal position of motion of the vertebrae. So if you have an alteration in motion or sensory input, you want to get as quick an appropriate sensory input in there so you can start regenerating the connections. And in fact, just a few years ago, they found out that you can regenerate neurons, which is like, oh my God, that's so exciting. Because we used to think that the cells can grow an infinite number of connections, but now we know that the brain can actually regenerate cells.
So after several years, that'll still even work?
Yeah. We've had tons of people, and they're always this one gal, brain damage because she was parents' nightmare. 5-year-old kid at the bottom of the swimming pool. Okay, and now she just took 20 steps walking, and before she couldn't even like move. Yeah, totally catatonic, and it's all just. I mean, first day I saw her, I started to unbolt stuff on her wheelchair because they had her locked in like this. You know, oh, that's going to get good proprioception. I got a Makita screwdriver, man. I know how to take one of those friggin' things apart. You know, she started to fall over, but, you know, I just said, hey, look, you know, let's challenge her more and push her around. Yeah, and she's doing better. Yes, ma'am.
So you said toxic blood, so varicose veins, when you...
Ooh. Kind of, but it's the varicose veins in the legs, particularly, are not generally from toxic blood, although it means the body's not healthy. It means that the deep veins are not working correctly. And that could be a mechanical distortion of the foot or the calf or the low back or the pelvis. Generally, because we're talking America, right? Yeah, the person's sick. Okay, they've got a toxic food, poor diet, you know, and the blood's not going to be healthy. So, you know, varicose veins on the legs, generally it's a mechanical distortion, but if they're an American, yeah, they're for sure sick. Yes, ma'am.
Are there any tests you can take for an impending stroke, like you're going to have a stroke in 2 months or something?
No, there's the best one would be a live blood cell analysis. And that would be the most accurate because the standard blood cells or blood tests that they do, they compare it. Have you ever seen one? You've got your results and then this reference range. Yeah, that reference range is different at every lab. It changes 3 times a year. They take 100 people without a diagnosis, and that's your range. And so you're being compared to the sickest population the world's ever seen. Okay, so I hope your range isn't there. Okay, you know, and it's a snapshot in time. It just doesn't make any sense.
It's different at every lab.
Yeah, it's different. It doesn't make any sense. Live blood cell analysis is cool because you actually see the state of the cells. And honestly, you're going to have like a wonderment at how beautiful you are. You know, you see this little drop of blood, and it's like Wild Kingdom. I mean, you'll see these macrophages chewing up little bacteria. You know, you'll see all these cells, and they're all flowing in one direction. God, live blood cell analysis. It's really cool.